My poster focused on, and my research focused on, is trying to look at the feasibility of using hashtags on Twitter to curate and give people better access to health information online. So there had been two hashtags that existed previously, BCSM and BTSM for breast cancer and brain tumor patients, and I took that and looked at trying to make that more systematic for a variety of diseases, feeling that all people with different malignancies deserved a way to find health information. In doing that, it then allowed some chats to develop around some of those tags, and my poster focused on analyzing retrospectively the data on what has accumulated over time from July 2011 through the end of 2014. And what we found is, in looking at over 500,000 tweets, that about 93% of those were focused on really discussion of malignancies based through chats. So while these other tags were there and there's been increased use so that over the last year it's doubled, most of them seems to still revolve around people involved in a community who talk to each other. And so that was sort of our main conclusion, where there were differences in user groups, but we didn't do a statistical analysis of it because some of these populations are so small. The two largest ones were still breast cancer and brain tumors because they've been around the longest. They had about 250,000 and 100,000 out of the 536,000 tweets that were analyzed, but there are active communities in other areas. So our conclusion was it is feasible and growing in terms of using these, and the hope is that there will be interest in providing access through a structured set of channels that provide a way for physicians, advocates, patients, caregivers to connect. So BCSM was originated by patients and advocates as a short way to basically curate the information on Twitter. And the reason that they used it is because it's unique, so it's findable, and it's short, which you need for Twitter because it's only 140 characters, and you want to save space for discussion. So even though it's not intuitive and doesn't make immediate sense, if you go to hashtag breast cancer, it's not organized and it doesn't have people that look out for what's shared on it. So the advantage of it, even though it doesn't clearly make sense, is if you look what's on that channel or that hashtag, there's a better signal to noise ratio where you can get more reliable information because people are actually there, and if it's not helpful or if it's problematic, some people will speak up if there's spam or other things that shouldn't be there. And if you go to hashtag breast cancer, it's anybody who uses that term, and it won't be as coherent to find other people necessarily.